everyone's heard about those horror stories about mistakes in the OR, when the operating room where like the sponge is left in and you find out later. No one wants that.
Right. They are exceedingly rare. We should caution that. But sometimes the simplest mistakes made by a doctor can cost you a lot. You can protect yourself from a serious and maybe life-threatening mistake. Dr. Val Jones is the founder and CEO of Better Health, and she's here now with what you need to know before a visit to the operating room or a visit to your doctor. Even. Thank you very much for coming in.
You're welcome. You're welcome.
One thing I find is that in this age of information overload, there's no excuse for not being prepared. You can do a lot of research yourself, on issues that are affecting you.
You sure can, and you know what? These hospital errors can affect anyone, even doctors, when they become patients and go to the ER.
You said you had something happen to you even?
I did. It's really amazing. That's why this subject means so much to me. I actually ended up going to an academic center of some note, and which shall not be named.
Nameless.
And I had some terrible abdominal pain. I went to the ER. The hospital was completely full, so there were no spaces, and I had to be on a stretcher for 3 days in the ER.
Oh my God.
And they kept moving me around because more people came in, and 3 days. And at one point I was on the stretcher and these security guards came up with 4-point restraints. Basically,
they thought you were a mental patient?
They thought they had confused, they confused me. Yes, someone had suggested that the patient in number 13 needed to be restrained because she was a danger to the department. And so they came to put a straitjacket on me, and I was like, I'm
not crazy.
And of course, everybody says it's not me. I'm not crazy.
That's what they all say, they said. And I was like, oh my gosh, I'm actually going to be tied up in the ER as a doctor right here, right now.
So did it get that far?
It almost did. And I said, please just check with the nurse again. Ask for the name. Here's my bracelet. Look at my name. Double check that I'm the right patient that you want to do that to, because I'm telling you, so you get the wrong gal.
Wow.
So this can happen.
It's interesting. When our little boy had ear surgery a couple years ago, and it was interesting because as they wheeled him into the operating room, it was his left ear. They gave us a pen and said, put a little X on the
which ear. Yeah.
Because we knew from all the symptoms which ear was bugging him, and so they had us do it. So I thought it was a wise decision.
That way you can't sue later, right? You X the right ear. But it gives you the sense of that you're in control of what's happening, because you hear about these things all the time. If someone's going in for something that's just an easy procedure, you think you're going to be in the hospital for a day or two. There's apparently things you can do as a patient.
Absolutely. Moving parts, and you just don't realize how many different ways there are to mess up. And so the best way to protect yourself, if at all possible, is to bring someone with you.
Okay.
Someone who can sit at your bedside and remind people to wash their hands so you don't get infections unnecessarily. Someone who can compare the med list that you're getting with the med list that your doctor said you're supposed to be getting, and basically take notes for you, because you're not going to feel well sometimes. Maybe you're just out of anesthesia and you need someone to make notes of what has happened and what tests you're going for and that sort of thing.
You can't keep track of that.
This is not easy work.
It's not easy work.
It's hard, time consuming, and you got to have your wits about you when you're doing this.
That's right. That's why it helps to have someone with you.
Especially the medicine, because you think someone comes in, you have different nurses, and it's not their fault. They're coming in and out on different patients and different shifts, and you just think, okay, here's the thing, I'm going to take it.
Right. And maybe you're off getting an x-ray when they come to give you your medicines, and you're not there, and then the shift changes, and maybe they forget to give you that medicine. And what if you have epilepsy and you haven't had your medicine in a number of hours because you were down in radiology? I mean, you can imagine how these things happen.
And the infection risk is just mind-boggling with the staph infections in the hospitals these days. I've known a couple of people who've gone in for very simple procedures, or little sores or whatever, and it turns into a full-blown staph infection where people almost had to have limbs amputated.
That's frightening.
That can happen. It's rare. And some hospitals do better than others at infection control, and those rates are published on the internet by certain hospitals. And I would highly recommend that if you see a hospital that's putting out their error rates, that's a really good sign, because it means...
Are most doing that? Because that's kind of saying, we suck. I mean, we messed up, we did this.
No, it's actually challenging their staff to make sure that they don't have these episodes, because they know if something happens, it's going to be on the internet, on their website. So that actually challenges staff to strive for that 100% zero error, zero infection rate. And so Paul Levy at Beth Israel Deaconess Hospital in Boston actually has publishes their error, their infection rates on the internet, and so you can trust that they're doing their best to make it as low as possible.
It's very, very difficult for a lot of people to question their doctor. They just assume that he or she is the know-it-all, well-schooled, and the authority figure, and so many people in our society are taught not to question that person.
I think that trend is changing a little bit. I'd like to think, I know my patients ask me a lot of questions, and I think I welcome that and I encourage that. Your doctor may know your disease and condition and the procedure that you need to have done, but they don't realize that you're off at X-ray when your meds are coming. There's sort of things that you need to check up on as well.
What kind of questions would you recommend that maybe patients are either too scared to ask because they think they're going above you, and who am I to ask someone with a degree and experience? What should we ask, or what's missed?
Well, I think it's very important for people to ask about the risks and benefits of the procedure they're going to have. Sometimes they're afraid to ask, well, what could go wrong, or what might happen to me if I do this? And I think it's really important to know what you're getting into, and to, during the informed consent process, to really ask those hard questions, because it's your life, and don't be shy.
And I guess if a doctor is going to give you a little friction, wrong doctor for you, right?
I would say so. If they're not going to tell you the risks and benefits, then that isn't a good doctor.
There's also research that could be done online. There's so many WebMD places online that could tell you this, this, and this. But you encourage people to go on there and kind of be an e-patient, you say.
Absolutely. There's a new movement called e-patients, and that is people empowering themselves with good information about their health so that they can be participants in it. And so you go to a credible website, you read everything that you should about your disease or condition, and then when you go to the hospital, you're much better equipped to know what to expect.
How do you ferret out the reliable websites from the unreliable ones?
Well, go to my website that has a list of reliable ones.
Perfect.
Right there.
GetBetterHealth.com. And otherwise, MayoClinic.com is always a safe bet. The American Academy of Family Physicians has FamilyDoctor.org. And then the government, of course, has Medline Plus, which is a terrific and trustworthy site.
So basically, do your research on your research before you trust. Research on the research before everything.
And if
what's the Sims motto? An educated consumer is our best customer.
There you go.
Right.
There you go.
That's my motto too.
Dr. Val Jones, thanks for coming on.
Thank you so much.